All right. So hello, welcome to the All In Resource Center. How are you doing?
I'm not doing the best, but okay.
How can we help you?
Um, I'm having issues. I am homeless right now. I've been drinking a lot. I've been searching, surfing, and everywhere I go, they drink. So it's not helping me any. I really want to change my life. I just haven't had the opportunity or anyone to help me. Um, I've had some really bad things happen in the past to me. I did finish some college. I'm willing to try to get back into that so I can get a degree of some sort.
Okay.
Yeah.
So I'm sorry you're in the situation you're in. Let me start by saying that before we kind of dive into your story and how we can help, there's a couple things that we need to go over. So just so you know, I'm a case manager here. Whatever we talk about here will stay between me and you.
Okay. I
And
appreciate that.
absolutely, absolutely. But there is a couple other things. Legally, if you were to report anything of self harm or child neglect or anything like that, or some type of domestic violence or any kind of suicidal ideations or homicidal ideations, I am legally required to report those. I just want to be upfront with you first before we kind of dive into this.
I understand.
So, you've listed a couple of things you have going on. Let me ask you. I guess let's first start. Tell me a little bit about yourself. Tell me, what when the drinking started and kind of how it progressed. What happened back in college and kind of how you got to the point you're at today.
Well, back in college, I don't want to really, like, I would rather have like a therapist or someone dive into some of my past history, but I had some trauma happen to me. Some guys, and some sexual stuff happened, and so I'm still living in it. I can still see it, and I hear things, and like the drinking just helps to. I guess I'm just self medicating because the drinking helps to for me to forget about what happened to me.
Are you drinking every day?
Yes, every day, and I drink a lot. So I don't want to stop drinking and then possibly have some type of seizure or something. They said it's really bad if you stop drinking and don't have the correct medical attention. So I'm willing to go into some type of rehab, possibly, and to help me get off the alcohol. I think that's where it'll start at.
Okay.
Hopefully, they have also some trauma therapists there that can help me navigate that.
Okay. Now let me ask you, what's your living? You mentioned you've been couch surfing. What exactly is your living situation right now?
I am homeless. I've been homeless over a year.
Okay, and you've just been couch surfing since.
Yes. Mm-hmm.
Okay. And do you have any work history?
I have a little bit in college. I did some volunteer service. Um, yeah. But I do have, a little bit of work history.
Okay. Is there well, I don't want to downgrade any job, but any professional jobs, or was it just mostly, were you working in restaurants, grocery stores?
Yeah, like restaurants, mostly
Okay.
food service.
Okay. Do you have a resume?
No, I don't.
Okay. All right. So, just for full disclosure, let me tell you, I'm a person in recovery myself. I've been able to achieve long-term recovery over the last, little over 5 years now. And I want to tell you that a lot of your issues that you have going on right now, the drinking temporarily masks those things. But as you know, I'm sure once you sober up and the alcohol goes away, those feelings come back.
Yes.
So I think our best course of action would to get a hold on the drinking first.
Yes.
So you mentioned, stop. You're scared to stop drinking because of kind of the withdrawal effects.
Yes.
So what we can do is, have you ever been to a detox or heard of detox or anything like that?
No, sir, I haven't.
Okay. So normally what happens, I can get you hooked up with a detox because, to be quite frank, alcohol withdrawal can be fatal if in severe cases. So what I would like to see happen is you go to detox for maybe a week to 10 days, and then we can get you set up with a residential treatment center.
Yes.
Now, the treatment center I have in mind is a place that can kind of address everything else you have going on as well. So once we get you detoxed and we get you to the treatment center, what we can do is we'll get you set up at the treatment center, and we can start to kind of peel back that onion of kind of what went on and where you went wrong and those feelings that you've been bearing for so long,
Yes,
whatever trauma it
I
was.
appreciate that.
I think it can help you in that way. We can kind of treat the underlying cause of your self-destructive behavior and kind of get you on the right path here.
Okay. Is it in-house? Like, will I get to stay there?
Yeah, so I think, especially since you are technically homeless right now, I think the residential treatment would be best for you.
Okay.
Even if you weren't, to be completely honest, residential treatment gives you a chance to get a little break from reality and be in a safe, controlled place where people are there to support you and help you.
Yes.
Let me ask you a couple more questions. So you said you're willing to get help, so that's great. That's a huge step, and that's the first step.
Yes.
Now, the trauma you've experienced, do you feel that is hindering you, aside from the drinking, in any other areas of life? Like, is it making it hard to maybe build relationships, or what does that look like for you?
Yeah, the trauma. Well, I don't have a lot of family. My mom is still living, but she's in another town. I just feel so ashamed of not finishing college and the things that happened to me, and I don't want to really bring her into that. So we haven't had the best relationship. So I don't know if they can help me with rebuilding that too. That would be awesome.
Yeah, one of the great things this treatment center will also do is that they do have that family component. So if that's something you're willing to explore,
Yes.
try to rebuild those relationships once we get the drugs and alcohol out of your system. We can lean on your family for support, and that can be great for the therapeutic process.
Yes, sir.
Now, let me ask you, have you ever been diagnosed with any mental health needs? Any mental health diagnosis? Depression, anxiety, anything like that?
Well, I haven't been formally diagnosed, but I know that I suffer from depression.
Okay.
I remember having some depression before the trauma happened, but since then it's been terrible.
Right.
Yeah, I really don't know how to talk to people and be out, and I am always just want to drink, man, and try to just get rid of the pain.
Okay. So a great thing about this treatment center we're talking about is it's a dual diagnosis facility. So they will treat your alcoholism, the drug addiction if you have any, and also any other mental diagnosis you may have, whether you said depression, anxiety. You can go through trauma groups and kind of in a healthy way process what happened back then, and hopefully get that situated.
I would like that a lot.
Absolutely. Now, as far as vocational training and a job, they do have vocational training there. So they'll help you, whether that's resume building or interview skills or whatever that looks like.
Yes.
Let me ask you, what do you feel that some of your strengths are?
I was good. I was pretty good in school. I managed to put together a 4.0 grade point average, and that's when I was focused, and that was before the trauma. And I'm definitely willing to get back. I have maybe 42 credits, and so I need 60 to go on, and so I know what I need to do. I like school, and
So would you say you're a quick learner?
Yeah, I am.
Okay.
School was really easy for me growing up, so.
Great. So going through treatment, have you ever been through treatment before?
No,
Okay.
not at all.
So it's similar to school. A lot of it's educational. You'll sit in groups and individual therapy, and they're going to give you the information. So, apply yourself the same way you did in school in treatment, and you can, pick up on the things the counselors will tell you and learn as much as you can. You'll learn those, healthy coping mechanisms for, when you're back out into the real world.
Yeah.
Okay, so that sounds great. Now, what do you think maybe some of your weaknesses are?
My drinking, definitely. My addiction to alcohol, to try to get away from everything instead of facing things. Yeah, definitely my addiction.
Impulse control,
yes,
coping mechanisms.
Yes, I say I'm not going to drink, and then I just automatically, it comes in my mind and I do it. I don't even think about the consequences. The fact that I've been homeless and just going from place to place, man, some of the places have not been really productive.
Right.
These people are, alcoholics themselves, and they take me until I don't have any more money, and then
Right.
they kick me out. So.
Right. Okay. So let's do this. I think we have a solid plan for right now. I'm gonna get you your intake set up at this detox, and I'm gonna, as well as the residential treatment. Now, a big part of that is when you're done with treatment. I would like to continue to work with you. If we can set up an appointment for after, and we can set up aftercare. And I don't know if you've seen any medical professionals lately, or part of being a productive member of society is taking care of ourselves, physically and mentally. So if you'd come back, I'd like to help you, get set up with a primary care physician and other, maybe a self-help group, 12-step groups like Alcoholics Anonymous or Narcotics Anonymous or whatever you're open to.
I've heard of Alcoholics Anonymous. I think I have Medicaid, so I would like to be set up with someone that can help me and maybe see.
Maybe like an aftercare, like an intensive outpatient once you're out
Yes.
of the residential, and it's been my experience that the more accountability we have once we leave treatment, the better and the better chance we have at success.
I do have a question about after the treatment. Do
Absolutely.
they actually help me with housing? Because I didn't want to go back to any of the places
Yeah.
I've been.
So a great thing they'll do is they'll give you resources, and they'll give you a list of resources of options, and I can help you with that as well. Whether that's another intensive outpatient that has a housing component, or a sober living facility, or if it's a safe shelter for women, whatever that looks like.
Yes.
There's tons of options, and we can explore all those. I think our best bet right now is getting you detox from alcohol and getting you into treatment.
Will they pick me up today, or do I have to wait and go get some more alcohol? Because once the withdrawals start, I get shaky and I can't function.
So I'm going to get you in this evening.
Okay.
So we'll get you into detox this evening. I think these need to be addressed immediately, because I think the level of crisis right now is rather high.
Yes.
With your excessive drinking, you essentially have nowhere to go.
Yes.
There's tons of risk factors that factor into your whole situation. So I think our best bet is to start tonight. Are you willing to go tonight?
Yes, I am.
Okay.
I really am. Thank you so much.
Right,
for
absolutely.
Your help.
So like I said, I think we have a solid plan.
Okay.
Again, let me reiterate, we signed the consent before we started our session here. And just so you know that anything we talk about will stay between me and you, obviously.
Yes.
When you get to treatment, the detox and the treatment center, what they'll probably do is have you sign an informed consent for me.
Yes.
So that way, while you're there, I can check in on you. They can give me reports. And then once you're done, we can, connect again and start working together again and get you connected with those resources that you need, okay?
I would like that a lot.
All right. Is there anything else I can give for you before we get on these phone calls and get you set up for this detox and rehab?
No, just maybe give my mom a call, if I could sign a release for you to call her.
Okay.
And just let her know I'm okay.
Absolutely.
Because I know she worries a lot.
Absolutely. We can do that right now.
Okay.
All right. Thank you.
Thank you.